Breast cancer is the most common type of cancer in women, with an average age of 15. It is a hormone-dependent cancer and is linked to reproductive factors such as possiparity, which means fewer pregnancies. There's also late first-term pregnancy, early menarche, late menopause, a lack of breastfeeding, and prolonged hormonal replacement therapy. The diagnosis of breast cancer can be made through clinical and paraclinical exams. Clinical exams include self-examination and clinical examination, which can detect breast swelling, skin or nipple abnormalities such as retraction, bloody discharge, and eczematous lesions. We also can find lymphadenopathy or metastasis at a late stage. There is some signs that suggest malignancy include badly limited character, hardness of the breast mass, and adhesion of the mass to the skin or deep plan. Also, if we find hard or fixed lymphadenopathy or a breast discharge, usually it is bloody. Paraclinical exams include mammography, which can detect a speculated opacity or find some suspicious microcalcifications. Also can give us some information about the skin or nipple and the thickness of the skin. Ultrasound can provide complementary information to mammography, especially for young women, and can detect irregular outlines, hypoechoic content inside the breast, or in some cases we can find a posterior shadow cones. In a Doppler ultrasound, we will find hypervascularizations of the mass. MRI is used to explore scars after radiotherapy and or surgery for breast cancer, and also it can help us search for complications after the implantation of a breast prosthesis. Finally, MRI can help monitoring patients treated with primary chemotherapy. Once the diagnosis is made, a pre-therapeutic assessment is performed, followed by a systemic check-up searching for metastasis, including a chest X-ray, abdominopelvic ultrasound, and tumor markers, such as CA15-3. Depending on the clinical signs, bone scintigraphy, cerebral CT, or PET scan may be done to confirm the existence of metastasis. Treatment for breast cancer includes surgery, radiotherapy, chemotherapy, and hormonal therapy. Surgery can be either radical or conservative. In both cases, we do an axillary dissections. Radiotherapy is used to control the tumor area and reduce the risk of recurrences, while chemotherapy is usually used to treat or prevent metastasis. Finally, hormonal therapy is recommended if the cancer is hormone receptive positive. After treatment, surveillance is necessary, including clinical examination of the operated and contralateral breast, lymph node areas, and a check for lymphedema, as well as a mammography and or ultrasound every 6 months after the end of the radiotherapy treatment. Contraception using estrogen is contraindicated due to the high risky link to the breast cancer. Screening for breast cancer includes mammography for women aged 15 to 74 in the absence of any particular risks. And for women with a family history of breast cancer, mammography is usually recommended 5 years before the date of the youngest familial cancer. Thanks for watching.